as we review an important topic. We will get started shortly as we continue to admit a few people. Okay, well, as I said, welcome everybody. My name is Namrata Ramandreesen, and we're pleased to have you here for this session on COVID-19, Where Are We Now? This is part of our continuing Well at UMD series, and we look forward to bringing you also in this month of October some other programs that focus on health as we also look at National Health Education Week conference that I'll talk about at the end of this session. As I was thinking about this session, a quote kind of came to my head, which is something to the effect of conversation is not about proving a point. Conversation is about going on a journey with the people who are speaking or you're speaking with. And in a sense, that's exactly what we're going to be doing today, is having a conversation about COVID-19, where are we now? And specifically looking at a campus, county, and national perspective with some of our esteemed panelists. So I just kind of wanted to set that stage as we go on and then go into a few logistics. If we could go to the next slide, please. Everybody's been on Zoom a lot, so I'm sure we all know the rules. We do invite you to keep yourself muted, but however, to use the chat feature to ask questions, and we will try to get to those questions. And this session for everybody will be recorded. So we just wanted to make those few notes and comments out there. So with that, I'm actually wanting to introduce one of my colleagues, who is Erin McClure, and she is the Chief of Staff, Director of Diversity as well, and Director of Operations at the School of Public Health. And she's going to take a moment to introduce the agenda, as well as review and introduce you to our moderator, as well as our panelists. So again, we thank you for your time, and we hope you have a great session and keep asking those chat questions. Thank you.
Thank you, Namrata, and thank you so much for welcoming the School of Public Health back to partner with UHR to talk about where we are now. We know that when we held a session like this about a month and a half or so ago, it was very helpful to our campus, and it's helpful to us too, those in the field doing this work. So thank you for welcoming us back. We're going to talk today about the state of COVID-19. We're going to share national, state, and county perspectives. We're going to talk about vaccinations and boosters and variations. And we're going to talk about informed sources and the procedures and policies and practices that are happening on campus, but also, all of this information combined so that we have a good understanding, a health literacy perspective, so that it can help inform our own decision makings and that of our families and our community. So I'm excited to welcome our moderator and our panelists today. I want to just name what we're not going to be doing is talking about supervisor decision making. So this is really about us talking about the information that we know and how we can translate that information to our own decision making. So today with us, we have as our moderator, Dean Boris Lushniak, who's the Dean and Professor in the School of Public Health. We also have joining us as our panelists, Cynthia Bauer, the Chair and Director of Health Literacy at the University of Maryland School of Public Health. We have the Deputy Chief Administrative Officer for Health and Human Services and Education for Prince George's County Executive's Office, Dr. George Askew. And we also have our own Health Center Director from the University of Maryland, Spiro Marinopoulos. So thank you, Dr. Marinopoulos, Dr. Askew, Dr. Bauer, and Dr. Lushniak for joining us today. Dr. Lushniak, you're going to get us started. You kind of have a framework of setting us off for this session today, and then we'll move into a conversational piece with some various questions that we've prepared, and also with questions from you all in the audience. Dr. Lushniak.
Great, thank you so much, Erin. And just for edification, my name is Boris Lushniak. I go with he, his pronouns, and I also go by as Boris. And we are going to stick with first names here amongst this esteemed panel. So welcome to Cynthia, to George, and to Spiro as well. As already stated, our goal here today is actually provide information to you, and hopefully information that you find fruitful, that you find helpful, and most importantly, that you walk away understanding things that perhaps you're confused with right now. So one of the mechanisms we want to use this afternoon is the chat function. If you have questions, please start posting them at any time in the chat function or after the sort of the discussions that we begin with. I also want to mention that George has to leave us a little bit early. I think about 5 minutes to 1, he'll have to leave us. So if there's any specific questions towards George at the county level, please also, I'll sort of monitor as well, so we make sure we use his expertise and skill set, but also as perspective from Prince George's County to be able to answer some questions. You know, I always begin sort of any talks I give about the COVID-19 pandemic to remind everybody how all this started and how long we've been at this. And now I'm using a brand new technique, which is I used to say, you know, let's try to remember what we were doing on New Year's Eve 2019. And now we're kind of forgetting, are we? Because it was 2019, was it 2020 New Year's Eve? It's a year and a half plus, almost a year and 3/4, soon going on 2 years since what happened, since the World Health Organization office in China was informed of a small number of people who had an interesting novel type of pneumonia that ultimately was found to be caused by a novel pathogen, which we now know as SARS-CoV-2, the virus, and COVID-19, the disease. To put it into another perspective, today is 640 days, 640 mornings that we've woken up in this new world. So compared to all the mornings that perhaps we've woken up with in our lifetimes, this is but a small number. And yet the 640 figure is really sort of a sense of, man, we've been at this for a long time, haven't we? And I would submit to you that almost most of those days of the 640 that we've been living through, that the headlines that approach us each and every day, whether you're a TV watcher, a newspaper reader, an internet news watcher, has circulated around the concept of this pandemic. 640 days we've been inundated with this. And what does that mean for the world? Well, at this point, you know, it's almost mind-boggling. 232 people, not cases, 232 million people have been diagnosed with COVID-19. Worldwide, 4.7 million people have died from COVID-19. From a positive aspect, in these 640 days, we went from something that we knew nothing about to the incredible speed and, yes, the success of modern science to first find what the pathogen was, this brand new novel virus, to find its gene sequences, to begin work on a vaccine. So part of the success story from a public health aspect is what? Over 6 billion vaccine doses have been administered worldwide. Over 44% of the world population has received at least one dose. On the other hand, presented before us is the unfairness, right? The equity issues of this world. When we look at low-income countries across the globe, only 2.2% of people in low-income countries have received the vaccine. Less than 4% in the whole continent of Africa have received the vaccine. So what I tried to sort of look at these 640 days is to do what? To show you the incredible progress we've had, but also the challenges, the difficulties, the inequities that exist out there. From a US perspective, if you haven't had a chance to see this, and those of you in the DC area, think about heading to the National Mall before Sunday night. Around the Washington Monument now are nearly 700,000 little white flags denoting each and every individual in the United States who has died from this. 43 million people diagnosed in the United States. But again, from a positive aspect, 389 million vaccine doses administered. So although we do have obviously changes in terms of how different regions, different states of our nation has accepted the vaccine, 65% of our population has received at least one dose. 56% have been fully vaccinated. Here in Maryland, we're doing even much better, 85, 90% at times in our region here. On campus, well over 90%. At the School of Public Health, 100% of our faculty and staff vaccinated. So that's kind of been the framework. And yet, as I mentioned, in those 640 days, each and every day, there's something brand new. And certainly the brand new feature that we've been hit with, right, from the euphoria of early June, perhaps going into early or mid-June, right, as we thought to ourselves, we're getting vaccinated, it's summertime, we can take the masks off, so we can show up at big events, has been the changes with the Delta variant, right, this mutation going on. And my first question to George is, we're hearing a lot about the Delta variant in the news, George. Can you share what you know about Delta and other variants and what we should know about them?
Thanks, Boris, and thank you for having me back. I always enjoy participating with the university, our flagship institution in the state of Maryland, and a tremendous partner for us here in the county, both in the health department and in health and human services as part of my portfolio. So what we know about the Delta variant is that it is more infectious than certainly the original version of the COVID virus. And the thing that changed most recently that set a lot of other wheels in motion is when we found out that the Delta variant could also be passed among folks who were already vaccinated. That there was a good likelihood of being able to pass that from someone who was vaccinated to someone who's unvaccinated, and vice versa. And so it really changed how we looked at how we were doing things here in the county, and it pushed us into mask mandates for indoors, recommending that the schools do the same. The schools did that, where the schools then went ahead and also did a mandate for vaccination of all their staff and employees. And so that's the difference for us that Delta has made. Without the advent of Delta, we'd probably be in a very different position than we are right now. The bottom line, and one of the things I want to make sure that I get across, even when speaking about Delta, is that the pandemic itself has become a pandemic of the unvaccinated. So the most important thing that you can still do today is to get vaccinated. Delta, any other variant that comes along, is going to be impacted by the number of people who are vaccinated and able to, because the transmission does slow if you're vaccinated, and the likelihood that other people get infected and the chance that the virus gets to mutate again and perhaps come along with something that's much more virulent than Delta itself is lessened by getting vaccinated. So making sure that all of us are vaccinated is an important piece. I do want to give some, there's good news here in the county, I would say. One number I want to give you is 1 million. Last week, we surpassed 1 million folks here in the county, or 1 million vaccines, I should say, that have been delivered here in Prince George's County. Now, when this all started and the vaccine rollout began, and I looked at the number of vaccines that we would probably have to deliver to put ourselves in a pretty decent place. The number I calculated was 1.2 million, and I couldn't imagine how we would get there at that time. And as you all may remember, with the slowness of the rollout, the issues at the federal and state level, which trickled down to the local health department level, getting 1 million shots into the arms of Prince Georgians is quite a remarkable achievement. And so we're very, very happy about that. And our current numbers, for those who are interested, are on the decline. In a good way, and the things that should be on the upswing are on the upswing in a good way. So our positivity rate is down, which means the number of folks that we're finding that are positive. Our infection rate, which means the number of people who are infected by someone else who has COVID, that's going down. And our case rate is going down. The number of cases that we're seeing on a daily and weekly basis is going down.
Great, thank you, George. Spiro, any reflections on Delta and how it's changed our atmosphere here at the campus level?
Thank you, Boris. Thank you, George. And thank you for having me back with this panel. Yes, so we have actually followed our CDC and county recommendations on campus as well. with our mask mandate indoors. We've gone one step further, asking our unvaccinated community members who have exemptions to also wear a mask in outdoor crowded spaces while on campus. And we are testing our community. We have a testing tent that we've set up at the health center, right next to the health center, actually, where anyone who is having symptoms could come and get a rapid antigen test and see if they may have the virus. So that's something that we've done. We have our campus testing twice a week for those who are unvaccinated at the stadium, and we recently expanded the days available of that testing to also anyone who's vaccinated who wants to be tested. So these are all some of the campus measures that we have taken to get a sense of spread around campus and mitigate that spread. We have also recently recommended that our students, faculty, and staff use KN95 masks, which are these higher level masks, which are more protective. They make it less likely for anyone who has the virus to spread it. And if you are wearing that mask, you're much less likely to also contract it. And we are keeping a close eye on our numbers. They are on our dashboard as well. And as Dr. Askew stated, for the county, our numbers have actually come down. We had an increase during the first 2 weeks of school, but we're now seeing a decrease in numbers, and they have stayed nicely low. So we're very happy about that. And our campus is currently at about a 98.1% fully vaccinated rate if we were to look on our dashboard. So we're very happy with what we are seeing the numbers to be, and we are thankful to our community for embracing our measures and keeping everyone safe.
Great, thanks, Spiro. Let's do talk vaccines a little bit. You know, to our listening audience here today, it's obvious that we are a group that you know are definitely looking at vaccines as part of the formula for us to fight this pandemic adequately. So, you know, it is part of the formula, and yet what we know is that the vaccine scenarios keep changing a little bit. I'll start with George, and George, you know, sort of updates from your perspective on the boosters. What's going on? I know we've had some confusion, and let's start with George, and then we'll go to Spiro, sort of viewpoints on the boosters.
Well, you know, I feel like as a government official, I need to apologize for our government as a whole, because I know everyone out there is confused. We get confused sometimes, but I think in that we have a pretty good handle on things. So, you know, with respect to the booster shots, they're now available for folks who received the Pfizer BioNTech vaccine. Those folks who received that initial series at least 6 months ago. The folks in that category who are eligible are, again, if they've received Pfizer, 65 years and older, folks who are 18 plus who live in long-term care facilities, folks who are 18 plus who have underlying medical conditions that may place them at greater risk for the most significant outcomes from having COVID, folks who are 18 and older who work in high-risk settings, and folks who are 18 and older who live in high-risk settings. And so importantly for the group here that we're speaking to, when we're talking about folks who live in, who, you know, this includes teachers, this includes daycare, childcare workers, healthcare workers, students in congregate living situations. So again, those are folks who can or should or may receive the booster of the vaccine. Now, so the folks understand why the booster is being recommended, is that what has been found is that there's been some research is showing that there's been waning immunity potentially for folks who receive the Pfizer vaccine, and this booster shot actually is being shown to actually increase the effectiveness beyond the original effectiveness of the one or two shots. The one thing I will say, and it's not really a message for campus because you all have been vaccinated or have exemptions or being tested, and you've done a wonderful job of getting quite a number of people vaccinated. But you have friends and family who will be asking this question, and that is, we're not going to booster our way out of the pandemic. We're going to, there's still the most important thing that you can do is to become vaccinated and recommend that your friends, families, coworkers, neighbors also become vaccinated. That's truly still the pathway out of the woods here.
And I think, George, it's important to clarify at this point, the booster really is for the Pfizer vaccine. And to our audience out there who had, for example, the J&J or the Moderna, I, for example, had the Moderna. What we're being told is data is still coming into the FDA for decisions to be made, right? So this is all data driven in terms of looking at the science of immunity, the science of the trials that have taken place. And so those of you who are Moderna and J&J, the recommendation really at this point is sit tight. There will be more information coming in the future, but it's not recommended. I repeat, it's not recommended to mix and match at this stage. Is that correct, George?
Yes, unless an extreme or an extraordinary situation presents itself where you would need to receive the booster or a third shot. If it was absolutely unavailable to you to receive the same dose of from the same manufacturer, otherwise it is not recommended that you mix and match. We'll say that folks are looking at that in other places around the world with respect to mixing and matching, and I think we're going to have new data out that may change the recommendations down the line.
And the question that just came up on the chat is, what about those who received J&J? Anything in particular on J&J?
No, it's still a waiting game, just as it's a waiting game for Moderna.
Great. Spiro, your sort of feeling on boosters here at the campus level, but also I want you to tackle sort of the next sort of scenario is, flu season is not just disappearing. It's interesting, for epidemiologically, last year, we actually had a real mild flu season. And the supposition may have been, since we were all masked and doing physical distancing and not congregating in large groups, that's how you stop the spread of respiratory spreadable infectious diseases. This year, we're kind of together. We're still masked. We're still all that. Hit me with your ideas on boosters, but also introduce the concept of the flu vaccine. And can I get both at once? What's the feeling out there?
Sure. So on boosters, I agree with George, and boosters for the Pfizer vaccine are available. They're available at the health center. Anyone in our university community who's over 18, according to the CDC, who's been 6 months out from their second dose of the vaccine may receive the booster. So we are making that available. I actually will receive the booster. When I'm eligible. I actually also did have Moderna, Boris, so we'll see when our turn comes. I also wanted to clarify that if you have been immunocompromised in any way, you could come back and get a Moderna vaccine. That is a separate category for individuals who are immunocompromised. So I just wanted to state that as well. With regard to the flu, yes, last year we were fortunate. We didn't actually have much of a flu season at all. And it could be because we were all masked, that we were staying home, remained physically distanced, all of the above, and which is a great thing. But this year we are expecting that the flu will come back. In fact, there have been some flu cases in Washington, D.C. that we heard about recently. And this past week, we had, I believe, 4 cases in Maryland that were laboratory confirmed cases. So the flu is here this season. And it is really important for all of us to be aware of that and to get our flu shots. We have flu shots at the health center. There will be flu clinics at the health center. We're actually planning campus communication very shortly. It'll probably go out early next week with more information about our flu clinics on campus over the next 3 weeks after October 14th. We're planning to have mass flu clinics that are organized by the health center. It is very important this year in particular for all of us to be as early as possible with a flu shot, because last year, all of us who were in the medical profession, we were worried about, well, what would happen if the flu came and we're dealing with both the flu and COVID at the same time? How would that make people feel? Will they get sicker? What does it mean to have a co-infection with flu and COVID at the same time? Luckily, we never had to find out, but I don't think any of us really wants to find out. So I think it's my personal opinion, and as a physician, it's really important for us to be ahead of this now with a flu shot and be able to go get our flu shots as soon as possible. So we'll make that available to our campus community. As far as getting a flu shot and a COVID shot at the same time, this has been looked at. Absolutely, people can receive the flu shot and the COVID shot at the same time. It is safe to do so. And in fact, if it's more convenient for people to do that, if they haven't had their COVID shot, or if they're getting a booster and they want to come in and get both shots at the same time, that's actually something that would be much more convenient for folks. So yes, absolutely, you can receive your COVID shot and your flu shot at the same time.
Great, thank you. George, I know you got to get going soon. Any final words for our audience here?
No, again, just to sing the praises of the university for doing such a wonderful job of getting folks vaccinated. Continue to do the great work that you have been doing and keeping the numbers down. And for those who, again, friends, family, relatives, neighbors, please do encourage those who have not been vaccinated to get vaccinated. We're doing a really good job here in the county overall with getting folks vaccinated, with well over 70% now of folks who are eligible fully vaccinated, and in the over 80% of folks who are eligible who are partially vaccinated, having received at least one vaccine. So again, thank you all for the great job you're doing, and thank you for your partnership. And we're Prince George's proud to be associated with the university.
Great, thank you, George, and great work on your and your whole team's part. And I know you have a lot of work to do this afternoon. Thanks for joining us.
My pleasure.
Thank you, George.
Let's bring sort of discussions from Cynthia on this from as the director of the Horowitz Center for Health Literacy. We're kind of at this new stage of vaccine requirements. We're discussing boosters, the issue of how people interpret all these various messages that are out there. We're also in the world of polarization, right? We're in a world where people are, there's the vaccinated, there's the unvaccinated, there's the mask wearers, the non-mask wearers. We still have to live and work together, and in a very stressful, emotional time. What advice and what expertise can you share with us from a health literacy perspective of how we view all this?
Thanks, Boris. As Namrata said, we're in a space where we're trying to facilitate conversation, and the broader context is not so much conversation, but a lot of debating and shouting and name calling and accusations. And I know that people are tired. I know they're stressed. I know they just want the pandemic to stop and go away and, quote, get back to normal life, whatever that means anymore. So the advice that I have to offer is probably it's going to seem a little bit challenging, but that is to kind of stay in a place of empathy and listening. And that is a really hard thing to do when you're feeling anxious and stressed and frankly angry, right? Because, this, as you all have commented, this university is a safe space in many ways, right? Because of the high vaccination rate, because of the masking policy. So when people are in this university space, the not that the risk is zero, it's never zero, but it's a lot lower than when we're in other places. But as you all observed, we have friends, we have family members, we have to go to the grocery store, to other places, and we can't have that surety. So I think part of it is from a psychological perspective, we're kind of all casting around for control. Like, how do we gain some control over this situation, which has been so stressful and uncertain? And, I would caution, I know the phrase pandemic of the unvaccinated has become quite popular, but I would caution us a little bit about anything that ends up labeling other people, either at the individual or the group level. What we know is that when people start to feel judged, none of us like to feel judged, but when people start to feel judged, you're going to start to see some kind of unpleasant engagements and behaviors. So, like I said, I know my advice is not going to be easy, but I think trying to listen and maintain some empathy, because none of us, at the end of the day, none of us like to be told what to do, right? We just don't, none of us. Even those of us who have complied with the university's requirements, we still don't like to be told what to do. So I think recognizing that that's just a very human reaction to the situation, we decided to comply probably for a whole bunch of reasons. Either we believe in the recommendations from places like CDC and FDA, or we thought we were doing something good for others or for humanity, right? Or just because the university told us and we wanted to come back to class or keep our jobs. Whatever our reasons were for complying, we did. But other people don't necessarily feel that way. And I think trying to see that at the end of the day, whenever this pandemic ends, we're still all in this together, right? At the end of the day, we're still going to have to do other things. We're going to have to solve other problems. And if we just keep alienating each other, I think we're going to end up far worse off than just what the virus is doing.
Great, thank you, Cynthia. Again, I'll tell everyone that sending messages or sending questions in, I'll be monitoring them as well and introduce them at various points of our discussion. Back to Spiro now. There's been some aspect of us being reminded, right, of what's going on in terms of the university's protocol. And specifically, can you clarify just the protocol when having symptoms, testing positive? How would you advise staff, faculty, and students what they should do should they encounter people who are not following university protocol? So remind us at least of some of the biggies of what's currently out there, and then what you recommend of how we handle those who may not be following protocols.
Thanks, Boris. So to the question as to what to do when you have symptoms, I mentioned earlier that we have a testing tent that's set up at the health center. If you're on campus and you have symptoms, you can come over and get tested. We want you to actually come to the tent and you can wait in line. It's drop-in during our hours, which are from 9 a.m. to 3 p.m. daily. And it takes about 15 minutes to get a rapid antigen test. These tests are pretty accurate when you're having symptoms, and you will know in about 15-20 minutes whether you have COVID or not. It's also respiratory season, so we all could have other symptoms that are not COVID. It could be a different virus, it could be the flu, but at least you would know that you don't have COVID. So that's really important to do. So that's really what I would say. If you're feeling unwell, stay home until you feel better. You can stay away from others. Come get tested. In terms of sort of how I advise our campus colleagues who are asking me questions, or if they're seeing something, if someone's not feeling well and they don't know what to do, I actually refer them to, we have some advice on the health center website about what to do if you're sick. We will be sending communications to campus with messaging about the cold and flu season very, very soon. So, and updating university websites with regard to that. But I would say if you see someone who needs some guidance, just guide them, encourage them to stay home, take care of themselves, get tested, and do the right thing. That's what I do with my staff.
Great, thank you. One of the questions that came in just now is, it's sort of an interesting question, which is, I know we're sort of under the auspices both of university policy as well as county policy, and George would have vouched for this, is indoor environments, obviously we're masking. The question is, what about people coming onto campus and specifically, audiences for performances, spectators, for example, at indoor athletic events? They're going to be masked as we're, in that scenario. Any consideration, like we've seen in some jurisdictions, of proving vaccination status? Do you get any sense of that? If George were on, we'd ask him from the political side what the county or the state is thinking about that. Any discussions at the campus level, Spiro?
Boris, we have had conversations about that with the county as well in terms of whether there are any requirements, and there are none. We are a highly vaccinated campus community at about 98% at the moment, and so we have masking requirements indoors that are protective of all of us. So we haven't felt that we needed to require or ask folks to show proof of vaccination. I think at the stadium, people do have to mask in indoor spaces. Outdoors, the risk of transmission of the virus is actually quite low. And so we're following county guidance in this, and we're also looking at our numbers very closely. As I mentioned, our numbers are quite low at the moment. So we haven't felt there's any need to add another layer of requiring a proof of vaccination or testing. And remember, we actually also are living in a highly vaccinated state and in a highly vaccinated county. And so those are all good things. So we are feeling good about not really needing those additional layers of testing or showing proof of vaccination.
Cynthia, I'm going to hit you with this other question, which sort of brings up the idea of how we deal with almost aspects of communication, and perhaps, embedded in that is health literacy, is the issue of the holidays coming up. And somebody asked a great question, I think it's Michelle, that says, any suggestions for dealing with the holidays when you have unvaccinated family members who want to gather for meals, for celebrations? How do you bring up this whole sort of discussion?
Yeah, I think, the kind of other rules about the rules of talking about difficult situations sort of apply here too. I think what people can do is state, calmly and with as little of a judgy tone as possible, why they got vaccinated, right? Like why they saw that as the thing to do to protect themselves and their family, or why their family's vaccinated. And, why they would also suggest that for a gathering, everybody at the gathering be vaccinated. I will leave it to you and Spiro to comment on whether or not asking unvaccinated family members to get tested would be an acceptable alternative. You guys can offer that from a medical perspective. But if you guys agree that could be, that is an alternative that is being offered to unvaccinated people, whether that would work at a family gathering or not, maybe that's a possibility. But I think it's really staying calm, kind of explaining from your point of view about why you believe vaccination is the best way to keep anybody at any gathering safe, and that you would just ask them to consider getting vaccinated too. So, but you guys can offer your opinions about testing as an alternative.
Well, it's interesting, and this goes back to some of the criticism of us at a national level. Other nations, for example, have really gone into this idea of rapid self-administered testing, and we're kind of behind as a nation on this. So one can almost imagine a world that we're not yet here in the United States, where you test yourself with a little at-home product that hopefully is sensitive and specific enough. And before you go to any event, whether you're vaccinated or not, you kind of say, okay, I tested myself this morning. I'm kind of in the clear now, right? That would be ideal. But any concept or any opinion on that, Spiro, in terms of family get-togethers coming up, of how you would deal with vaccinated and unvaccinated being together?
Yeah, so I think it's a great point about the rapid antigen testing, which people could do. The problem, of course, with that is there's a very short supply at the moment. I think I was looking for one for my daughter the other day, who was 15 and had some symptoms, and said, "Dad, can you test me?" And I couldn't find one within 100 miles of where we were living. So I think from a public health standpoint, it would be great if we had tests available and that were made available widely to everyone, and then you can just test yourself, and it's very simple, and you can know what to do. Masking is sort of the strategy that has been deployed by county and by us in terms of being safe in environments where we don't know what everyone's vaccination status might be. And what I actually like to say is that we have to assume that the virus is around us all the time, even if even if we're going out to the store or just doing something, anyone could have the virus. So we all want to try to take the steps we need to take to protect ourselves from that, and we really don't know who's vaccinated, who's not, who may be close to us. So that's why wearing our a mask, a high quality mask, I think is a good way to think about it. We know that recently we provided K95s to our community. I actually have some that I use myself, and everywhere I go, and it's really just about being careful, because we will not know folks' vaccination status, and we will not know where the virus might be or where we might become exposed to it. So that's really the way that I've been thinking about it. But it would be wonderful if we had the ability to mass test everyone, and just have a supply of these tests. And it's done in other countries. They're available very inexpensively, actually, and people use them.
Can I ask you both if what we're trying to do is offer people things that they can, that'll help them have these conversations? Would you suggest that people consider some of the pre-vaccination strategies, like people were having their events outdoors instead, or they were, if they were going to get together, they were quarantining for a certain period of time before they agreed to get together? Would those be things that you would feel people could still offer as alternatives to kind of keep the temperature down and keep family harmony?
Oh, I think without a doubt. I mean, the reality is that, it gets a little bit more difficult as we, enter the cold weather season. But the more, let's be honest, the more we can do sort of the group activities outdoors versus indoors, the more protective that is. And so the whole idea of even having those discussions, smaller groups as opposed to the larger groups, windows open versus windows closed, outdoors versus indoors. And along those lines, we had a few questions talking about, indoors versus outdoors. And then specifically, Spiro, I know we had a sort of a pre-discussion about this. How do you define a closed area? What do you do? What are your practices in terms of being in an office setting? And are you masking or not? And how would you recommend, people do this?
Great question. And so I actually personally am pretty conservative about how I view this. So right now I'm in my office with the door closed, alone. So I'm in a private space, and I'm not masked. If I was somewhere again by myself, I would consider that to be, private. So I might not mask. But if I see somebody else in that same area, I might put my mask on. So that's how I've been thinking about this in more practical terms, so everyone can think about it, sort of different ways. But I'm thinking if I see somebody else, in that same space, I will put on my mask, and I think that's a good, safe thing to do.
Cynthia, I'm going to hit you with this next question, and Spiro, if you want to add in a little bit. And it really deals with this whole idea of how best to deal with this idea when people don't follow sort of the policies and the recommendations, and specifically when it comes to masking, right? I see somebody walking down the hallway, they're not wearing the mask properly. From a health communication aspect, how do I intercede? And the curved ball on this, as the person who asked the question, is what if that person happens to be my boss, right? My supervisor, so you have this pecking order that exists in any organizational chart. Any recommendations of how best not to set it up as confrontational, but as, as informational?
Yeah, a lot of this is relationship based. I mean, I would just say personally, right? I'm not making this as a recommendation, but I would just say personally, I've been in a few situations where I'm in a public setting. I don't know the people who are not wearing their mask either properly or at all. And I just try and move away from that space, remove myself from that situation as quickly as possible, right? Because I feel like just like we don't know who is has the virus, we don't know how people are going to respond to just a random message from a stranger. My guess is in the current environment, probably not well. And I think you have to sort of be trade-off in terms of thinking about, do I stick around and try and like really have this verbal altercation with somebody, or can I just remove myself and take more of a self-protective stance? In terms of when you're in a situation like with your, boss or peers or, co-workers or whatever, I think I tend to revert and would recommend reverting to framing it from your perspective, right? That's the so-called I language, right? I would feel more comfortable if we're all following the rules, and the rules here on the university are that we're all supposed to be wearing our masks while we're inside. If somebody doesn't comply, I think I'd say, well, I really feel uncomfortable with this. I think, can we cut this meeting short? And, maybe we can have it over Zoom or at a later date or outside or something. I mean, I think, again, because we know there's a lot of sensitivity about people feeling like they're being told to do so many things, I try not to get in a situation where it's me telling somebody what else to do. I think you try and offer alternatives. If that doesn't work, you try and remove yourself and kind of get into more of a self-protective place. But, none of these things are going to be easy. I mean, talking about these topics is going to potentially make us uncomfortable as well. So, probably practicing, will help, right? Just like kind of role playing in your head. Okay, if I'm in this situation, what could I say? What would I say? How would I respond? Just kind of anticipating a little bit of that might help prime you so that when you do end up in those situations.
Great, thank you, Cynthia. Spiro, those of us who remember the spring and the past year realized that we had a pretty vibrant quarantining process going on, right? Students who were exposed, were put into quarantine. Students who were positive were put into isolation. What are our quarantining rules right now? The scenario is I'm vaccinated, but I was exposed to a COVID positive person. What are we doing?
So one of the benefits of being vaccinated is that if you were exposed to someone who was positive, and exposed means, and I'll just remind the audience, it means being within 6 feet of that individual for 15 minutes, and it could be 15 minutes at one time, or it could be cumulative over a 24-hour period. That's what being exposed means, or being in close contact. But if you're vaccinated and you're exposed, you actually don't need to quarantine unless obviously you have symptoms. If you're not feeling well, then you ought to get tested and isolate and all that. But as a vaccinated individual, your risk of, and especially if you're masked, which we all are indoors these days, your risk of contracting the virus is actually quite low. So you can continue doing what you're doing, going to work, going to class, but you have to get tested in 3 to 5 days after the date of the exposure. So there is, as I mentioned earlier, testing available at the stadium 4 days a week. And those of us in the community, in our community, can go over and get tested. It's fairly quick. and we get a result, of our test. This is a PCR test, and then if the test is negative, then we're all good to go. If the test is positive, obviously, then that means we would isolate. What's really important is also during that time period that we all wear our mask, and we all do that anyway. So there's not much difference there, but we also want to watch out for symptoms because obviously we had an exposure. So if the next few days we started developing symptoms, we really want to be aware of it is possible that we may have contracted the virus, and then we want to stay away from others and get tested. So, but that is the benefit. One of the benefits of being vaccinated is that we do not need to quarantine. Now, if I was unvaccinated and I had an exposure, was a close contact to someone, then I would need to quarantine, and that would be for 10 days. So that's the difference between what we're doing this year with the vaccine and what we were doing last year without the vaccine. Last year, without the vaccine, anyone who was a close contact would have to quarantine, and that is no longer the case.
Right. There was a person who sent in a question that I'll briefly answer. And the question is, sort of expectations of family members, vaccinated, for example, that, before get-togethers regarding, can we ask people to get tested? And my viewpoint, it goes back to my previous question, that one of our issues, I think, right now is sort of this lack of availability of a rapid test. It would actually change our lives to a large extent. You can almost imagine, again, on that personal level. I'm heading to get together tonight. I'm going to test myself, rapid test with quick turnaround that's inexpensive beforehand. And so therefore I can, rest assured, again, sensitivity, specificity of testing being part of the issue, is that I'm kind of clean going into that. Can we have the same expectation for family members? Yeah, I think we can always ask our family members to sort of be more, prudent regarding, testing, even if they're vaccinated. It makes everybody feel comfortable. It all depends, I think, on a personal level, how open you are to have that discussion, right? And again, the availability of such testing. Are we issuing any waivers? Somebody asked a question about, people not wearing masks, and are there conditions or legitimate reasons for not wearing a mask? Have we issued any waivers for not mask wearing at all, Spiro, here on campus?
So there are no exemptions for that, but there could be an individual who has a medical condition that would prevent them from wearing a mask, and there's a process for applying for that and providing an adjustment or accommodation for that. So we have had occasional cases that I'm aware of where we granted something of that sort, but of course that gets complicated because it depends on where that individual is working. There may need to be accommodations with regard to the work place, etc. So that gets assessed on an individual basis, with submission of documentation, and so I couldn't really comment broadly on that.
Right. Another comment that came up is this whole issue of, part of the issue of vaccination and part of the issue of masking on campus is to make sure we not only protect ourselves from each other, but in essence, we don't know what environments we're coming into in our home setting, right? An example here is unvaccinated children or higher risk individuals, elderly compromised individuals. So we do want to make it very, very clear that, we need to ensure that rules are being followed so that employees can feel comfortable coming to work. And I think that's a key feature here. So, this whole issue of our policies and finding impactful ways of making sure people follow these policies are going to be critical. So a very good
Boris?
Yes.
Boris, can I just comment on that too?
Absolutely.
So, I think it's really important, back to your point, because of the power differential between, supervisors and managers and their staff and employees, that managers and supervisors take that responsibility to ensure the safe workplace, because then it's not on individual employees to constantly have to speak up or to try be in a position, that uncomfortable position of having to point it out to their own supervisor or manager. So I do see this as something that, has to come from the top down, and, that people are consistent, that they do make clear these are the workplace rules. It's not a matter of whether we like them or don't like them. These are the rules. This is what we need to do to keep each other safe here and when we go home and go out off of the campus. But I really think it's a management responsibility as part of workplace safety.
And this is, Aaron just wrote me saying, this type of question is coming up a lot in our chat functions and in direct things. Namrata from UHR or Aaron from sort of our perspective, any comments on this, of how we look at it? This seems to be really of interest to our audience.
Sure, Boris, I can comment here. What Cynthia shared at first is very important. I think direct communication can actually de-escalate further concerns. So when we feel comfortable and have built some type of relationship to be able to have that conversation with someone, I encourage that. But what you're talking about, these are very clear dynamics. And we know of instances across campus where people are not taking these protocols seriously repeatedly and continue to unmask even once told to mask again. And the campus has clear processes about this and procedures to follow when these things aren't happening. And so I would encourage, and I know we practice this in our school, to inform your leadership, inform the dean, inform like someone in my role as a chief of staff and director of operations. We have language and narrative that we share out with an individual that has been reported as not following this. And then there are next steps that campus has put into place of taking action if the compliance is not continuing. And we can take on that responsibility, and that responsibility is not put on the individual so that they're feeling like they're being put in a compromising position in a variety of ways that might impact them.
Right.
I have just a quick on that too. If there are methods to report or non-compliance anonymously, actually there's a ethics, compliance, and integrity report for any behavior that is concerning, and I believe that can be made anonymously, and I think that's also been communicated in some of our campus communications. And then for students, there are similar referral forms to the Office of Student Conduct. So if I think earlier we were talking about it, approaches to engage with an employee or educate, etc. But there are also approaches that are, that would address behaviors that are concerning as well, that are available. And hopefully none of us have to use them, but they are available if there are concerns.
Great. Namrata, you had something?
Yeah, I just wanted to add, we, in terms of UHR, we obviously have our staff relations department that can offer assistance in terms of particular situations that might need to have a bit more hand-holding. And we also have on our website sort of a manager handbooks that can help in some of these situations. And if need be, there can also be a conversation training class about crucial conversations like this that can be organized for groups of or departments as well. So there are some resources that are available to folks as well.
Great. We have only a couple of minutes left, and I'll do a concluding statement for about 30 seconds. Cynthia, a question to you is, how do we stay informed, up to date? What sources do you use?
Before we do that, there was a very important question that came in about whether higher ed is included in the education for booster. So I think we answered that question earlier, but just to confirm that right now, yes, the campus and the county are interpreting that, right? I just want to make sure that question got answered.
Perfect.
Absolutely.
Okay. Yeah, so we certainly CDC and FDA are the go-to places for, the official information. I was talking earlier before the session got started that I've noticed that Tom Frieden, who is the former CDC director, has a very active Twitter account where he's really trying to use plain language to explain a lot of the science and to offer very clear and explicit recommendations. So if you're a Twitter user, you might take a look at Tom Frieden's feed and follow him. And then, of course, there's information from various universities like Hopkins, the Kaiser Family Foundation. So I'm going to put a link here We also, in the Center for Health Literacy, we have a COVID project that we're doing for CDC, and we're creating a weekly hot topics where we're trying to pick up those things that are in the news, in the headlines, distill that information and give people very plain language, concrete things to do. So you can sign up for that hot topics newsletter.
Great. Spiro, you got 30 seconds. Why are you optimistic about where we're heading here?
Boris, I'm very optimistic because we have vaccines and we are a highly vaccinated state, county, and campus community. So that is wonderful news. And we didn't have vaccines previously. I'm optimistic because our case counts have been dropping, our positivity rate has been dropping. And we have been able to gather as a campus community. We've been able to bring 50,000 students, faculty, and staff together. And if we think about where we were a year ago, we couldn't have done what we've been able to achieve. And so we have a lot to look forward to. We know a lot more about the virus. We know a lot more about how to treat it. We know a lot more about how to prevent it. And we have a lot of measures at our disposal that are making us safe. So I think we are very optimistic at the moment, and certainly we're in a much better place than we were a year ago when you, as you started mentioning at the beginning of this.
Great, thank you so much. And I'll continue with my optimism before handing it back to Aaron. 640 days, as I mentioned at the beginning. Do vaccines work? Yes. What do we know? There was a question about, will it decrease the amount of time that I'm positive? There's a lot of data we don't have on the vaccines. What we know is this: get vaccinated, reduce risk of infection by a factor of 5, reduce risk of hospitalizations by a factor of greater than 10, reduce risk of death by greater than 10, right? Those things prove that the vaccines do in fact work. So that's important. But also 640 days into it, if you've seen today's headline, it deals with a potential antiviral drug, a pill, right? That may be helpful in treating the disease after we get it, or even post-exposure, right? Look at today's news, and the sense is this may or may not work, but that's where we've been progressing. Each and every step along the way, we've been progressing to something that, well, maybe this is going to be part, not the final answer, but part of the answer of how we're going to deal with this pandemic. Aaron, back to you.
Thanks so much, Boris. I appreciate my optimistic piece is that I appreciate all of you for continuing to care about our community, to share information, help keep us informed, and to model these practices for us, and to share these things with us honestly and openly, and even model vulnerability. I think that's critical, us to coming together as a community. So I appreciate you all for that, and I appreciate UHR for partnering with our school and with the folks that have joined us as panelists today and making this happen. I want to name that we do have some upcoming sessions that we believe is also related to this, but more broadly in terms of our wellness, overall health and wellness. And so I don't know if the slide can be shared for that, but just we will be partnering again with the School of Public Health and UHR and offering a Happy and Well at UMD session. That's part of our Happiness and Wellness Initiative. With a variety of tips and tools, and that's in collaboration with partners across campus. And then Namrata, did you want to share about the Health Education Conference?
Yes, October 18th to the 22nd, in alignment with open enrollment, we'll be having a health education conference where there'll be at least 6 workshops that you can choose to attend over the course of those 3 days. And following that, there'll be some more information about open enrollment, again, all in the auspices of wellness and health. And I just wanted to also take this opportunity to thank each of you for attending and taking time to participate, and also to our panelists and our moderator and Aaron for all the hard work behind the scenes to make an event like this happen. So we are very grateful, and thank you for that.
Thanks, everyone.
Great. Thank you all
Till
for
next
attending.
time.
Thank you.